If you look at these photographs, the upper one shows healthy gums, which are pink, not red and not swollen. You can see a small triangle of pink gum tissue between the teeth. The lower photograph shows inflamed gums, which result from inadequate daily oral hygiene. You can see that the gum tissue here is swollen and red. Here we can see what happens if plaque is left around the brackets on a consistent basis. This white line right here is where plaque was being left around the brackets, and the plaque leached calcium out of the teeth, resulting in a permanent white scar. That scar is called decalcification, and that's what we're trying to avoid by having excellent oral hygiene. This photograph shows more severe decalcification. This whole entire chalky white area here between the bracket and the gum line is now permanently and severely scarred. And this picture sadly shows the ultimate consequence, what can happen when a patient not only doesn't practice great hygiene, but doesn't come into our office for regular visits. This patient disappeared from our office for over a year, and during that year also did not have any professional cleanings at the dental office, which are very important since we do not clean teeth here at Total Orthodontics. Remember, this is what we're looking to see: small pink triangles of gums which are not inflamed. We know it takes a lot of time to clean teeth with braces, but it's absolutely worth it.
Hi, I am Greta. I'm a clinical technician here at Total Orthodontics, and I had braces as a teen. I had my braces here at Total Orthodontics with Dr. Thoreau and Dr. Barefoot. There are 4 key components to your successful oral hygiene, including brushing 3 times a day for 2 minutes, flossing before bed, using a fluoride rinse such as ACT, and professional cleanings at your primary care dentist every 6 months. Please note that as your orthodontist, we do not clean teeth or check for cavities. Let's talk about brushing and flossing when you have braces. Use a soft toothbrush 3 times a day for 2 minutes minimum. Use small circles at the gum line where your teeth and gums meet, like this. You can only brush about 2 or 3 teeth at a time before needing to reposition your toothbrush. Be sure to brush all the sides of your brackets. And be sure to get the bristles of your toothbrush underneath the wire. Don't forget to brush the biting surface of your teeth and the inside surface as well. A sonic toothbrush is a great adjunct, but it is not absolutely necessary in most cases if the patient is diligent. To get underneath the wire of your braces, please use the proxy brush that is included in your hygiene kit. You can get more at your local drugstore if necessary. Thread the proxy brush underneath the wire at each contact. Some places may be difficult to reach. Don't force the proxy brush, or you may accidentally break a bracket. We would like you to floss once a day. Flossing with braces is a bit challenging and requires the use of a floss aid. 2 popular brands are platypus flossers or placker flossers. They come with a thick end and a thin end. The thin end should fit underneath your arch wire. These flossers may be difficult to reach in some places. Do not force the flosser as it may accidentally break a bracket. In the hard to floss areas, you may need to use a floss threader. These threaders are provided in your hygiene kit. Simply thread the floss through the threader and use the threader to place the floss underneath your wire. And floss each contact. You may also use a water pick if struggling, but this is not a substitute for flossing. After flossing, please use ACT fluoride rinse. Rinse with it for 1 minute, spit it into the sink, and go to bed. Do not rinse with water after. Please note that many oral rinses do not have fluoride in them. We recommend the ACT fluoride rinse. Additionally, your hygiene kit contains orthodontic wax. Wax is used to cover especially pokey parts as your mouth adjusts to having braces. Simply take off a piece of the wax, mold it between your fingers to soften, and place on the offending bracket, wedging it between the bracket and wire. Diet also plays a role in successful orthodontic treatment. Watching what you eat is also important because certain foods damage braces. In general, it is important that you refrain from eating really hard, chewy, and sticky foods, as these foods break brackets, and broken brackets usually result in extended treatment time. A single broken bracket late in treatment can sometimes add 3 months to treatment, and we know you don't want that. If you have a loose bracket, please call and we will get you into our next repair slot. If you come to your adjustment appointment with unannounced broken brackets, we may have to reschedule you to repair them, so letting us know ahead of time is in your best interest. It is important to minimize drinking Gatorade, juice, and sodas during orthodontic treatment as they contain a lot of sugar and they are acidic. Both of these can really accelerate the process of decalcification. Popcorn must be avoided if you have an expander or space maintainer.
Remember, amazing effort equals amazing smile. Thank you for choosing Total Orthodontics. You've got this.